You want to know your baby's position? Stick around. I'll show you everything you need to know and much more. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Hi, I'm Dr. Natalie Fizet. We're going to talk about your baby's position today. There's actually two components in two ways to know the baby's position. There's your part where you can feel the movements and you can have an idea how your baby's position. And there's the doctor's or midwife's part, which can be by the exam or by ultrasounds. So let's talk about your part. Okay, I have a demo here. I ran out of real babies. I'm too old for that. So this is my assistant. Say hi. So your baby can be what they call vertex, the head down, which is the most common position. 95% of babies at term or head down. I see a lot in chat forums, chat groups, people saying, I'm freaking out, my baby's breech at 30 weeks. 30% of babies are breech at 30 weeks. It means nothing, honestly, unless you deliver, unless you break your water as I'm talking to you. But if not, the baby's going to turn. Okay. The head is the heaviest part, and it's also the hardest part. So at one point, baby moves around and has fun. And at one point, like the pelvis is shaped like this. So the head gets stuck, not stuck, but it goes down in the pelvis. If you can see my hand, it's like a bowling ball in the gutter. So after it starts descents, it's harder to turn around because it's in the pelvis, like my hands would be the pelvis. So the baby's like, it can move like this, but that's it. So that would be vertex, head down. Then we have the back part, the baby's back. It could be on your right side, could be on your left side, or it could be in the middle. If it's not your first baby, if you've had 5, 6, 7 babies, your baby is in any position, honestly. So most babies will have their back on your left hand side. So that would be their position like this when they're born. The feet can be folded or it can be unfolded. So then you get more movements up here in the ribs. Okay. And by the way, I've had patients saying, my baby's pushing on my ribs, it's hurting. I've seen not broken, but sprained ribs from the baby pushing because their legs is pretty strong. Most of my patient would say, "Oh, it's uncomfortable," so they would push on the baby's leg. But then baby thinks you want to play with it, so it's going to push more. So it's not the best reflex to push on the baby when he's really pushing up your ribs. And I'm 5 feet tall, so I've had babies pushing on my ribs. The best is to lie on the other side, so that way it liberates your ribs, and baby doesn't push as much on your ribs. That's a side note. That's a bonus. So baby can be with the back on your left hand side, could be on the back on your right hand side. And the most movements is usually the legs, like I was saying. So try to pay attention where up, hopefully up there you feel the movements. That would be the legs. So the back would be on the other side. Okay. Baby has hiccups often. So if you feel like hiccups are really regular, you can call it. You're going to say, okay, it's going to jump, is going to jump again, and then you can feel. So that's usually the head. So if you feel hiccups in your near your pelvis area, that's a good sign. It means most probably the head is down. All this is relative. Some babies are tricky and they could be breech and you feel the hiccups down there. They're full doctors, they're full parents, so it's not that 100%. Okay. By the way, fun fact, when the baby starts descending, when you're near your term, at one point you might feel the hiccup in your anus. It's a really weird feeling, but that's a good feeling. That means baby is getting ready to get out because it's really close to the exit. But believe me, put that in the comment if you ever felt that. It's baby's hiccup, so it's regular, like beep, like this on your anus. So that means baby is really close to getting out. So it has started his descent. So Most babies will be facing mommy's back, so to get out, and it's easier that way for the baby to come out. On the other hand, some babies will be what they call posterior, so they're called sunny side up. If you can imagine my baby getting out, we see the face, so I go, "Hi, baby," when it comes out. But that could give you back pain labor because the hard part of the head is really pushing on your sacrum, on your pelvis. So the best way to alleviate that kind of pain, and you can try changing position hoping that baby will turn. If it's not your first baby, again, it can turn. I've seen babies, the head is out and then it turns, so there's more room when it's not your first one. When it's your first one, it's narrower. So to alleviate like the pressure on the back, you can have your birthing partner counter pressure on your back, okay, on really low back, counter pressure during a contraction, and they really have to squeeze. I've seen a husband that was like white knuckle, and his wife was going harder because the baby was pushing. You can also go on your hands and knees or lean on the ball or go in water. So that way it alleviates the pressure again of back labor when your baby is sunny side up. The head is still down, okay? But it's a posterior position, but it's not the posterior, it's the occiput. The baby's occiput is posterior to the mummy's. So that's different. Okay, flip it around. Now we have a breech baby. This is what we call, oops, a frank breech, which is like the butt coming out first. This you can deliver vaginally with an experienced either midwife or a doctor. Don't chance it. If always ask if your baby is breech. Um, and again, the movements would be different. You would feel like more like little things on your bladder here at the bottom, but it's not that obvious because hands move too. So at one point it's like it's moving all over, so it's not that easy. But you might feel like a hard lump like under your ribs, and your doctor will also, or your midwife will also check the baby's position, and we check for that little head here. So if the baby is frank breech, you can deliver if it's not too big, if we're not having a 10, 11, 12 pounders. I've delivered big breech babies and it's fine if we have all the criteria. The head usually has to be like flexed, so it's not like this, so the chin doesn't get stuck on the pubic bone of mommy's pubic bone. And there's the other kind of breech, which is the feet, or if it's bent at the knees and you still have feet, that is not recommended to be delivered because if one feet comes out, the other one is in, we're in trouble here, okay? And baby could be in trouble and the cord could prolapse and all kinds of stuff. But frank breech, the butt, that's deliverable. I've delivered not a lot, but many breech babies. Okay, I always did it with the gynecologist with me in the room because it's always better to have four hands, and it all they all delivered beautifully. Okay, the other position is what they call transverse, which is like this. The name says it, it's transverse. So the head could be on this side or it could be on the other side, okay? And usually the legs would be flipped. That's an unstable position. Usually baby's still floating around. So rarely during labor at term would you have a transverse baby unless it's like a 10th or 11th baby. Or if you have twins, um, and they're side by side, okay. To deliver twins, the first one has to be head down and the second one could be breech. But if the first one comes out, if you can see, it came out. And then the second one, let's say it was head down, but then there's a void here. The first one came out saying bye-bye. So this one could flip on the side. So usually we would do an external, just we don't we could go in, but usually just by touching the belly, we can position this way. Or the baby can place itself in breech, and since it's a second baby coming out there, we know that it won't get stuck or anything. Sometimes they do what they call the big extraction. They go grab the legs from inside and they pull on the baby. That's rare, and that's experienced gynecologists that do that. So that's the position. Transverse, don't worry about it. If and so many people will say freaking out at 30 weeks, my baby was transverse. It's going to change, okay? And again, the head is really heavier, so it goes down this way. And with the form of the pelvis, once it's down there, it's gonna stay there. I've questioned myself saying, why do babies put their head, how do they know to put their head down? It's not because they have blood in their head. They stay for weeks like this, and the blood is pumped by the umbilical cord, so they don't have the gravity and the blood rush to the head. And I would go to conferences and I would ask the speaker, why do babies put their head down? How do they know they need to come out this way? And most of the times they would say, oh, I don't know. And even they were like experienced speaker with, 30 years experience, they was like, I don't know. So it's kind of a mystery why the baby puts his head down. The thing, like I said, is it's heavy. And also the shape of the head being round at one point, once it's in the pelvis, baby would try to turn around and it could not. The one thing we also know, one of the speakers told me, is we know for a fact that, and by no means I'm saying that if your baby's breech, it has problem, but they say that babies who have muscle tone problems or inherited diseases or anything would be more breech because they don't have the tone to move around and turn. Doesn't, like I said, I'm repeating myself just to be sure nobody freaks out from my videos. If your baby's breech, it doesn't mean by any means that it has tone problems, but we know that babies who have tone problems will be more breech. I hope it's clear. Don't freak out in the comments. Oh my God, you just said I didn't say that. Okay, so pause, rewind the video if you have to, but let's get clear. So that's your part. If you feel the hiccups under your ribs again, baby might be breech, okay? So the best way though is to combine going to see your midwife, your doctor is going to tell you how the baby's position. A good midwife, a good doctor will start checking the baby's position in the last 1 or 2 months before birth. It's basic, okay? We need to know that. If they just chit chat with you and don't check that, okay. There's what they call the Leopold maneuver, which is basically we're touching the pregnant woman's belly to try to feel the baby fingers in the eyes, to feel the baby how it's positioned. Okay, in many videos they're like, oh, we know for sure. We don't know for sure. I've had breech babies and their butt was so squeezed that when I checked, it felt like a head. It's not 100%. That's why I had in my office a small ultrasound machine that I bought, I think directly from China for cheap. And I would tell my patients, I'm not 100% sure of we're never 100%, but I'm not like sure enough of the baby's position. I'll check. I always told them, don't get excited. It's a really short ultrasound. I'm not going to show you anything except a round thing, which is the head, because the head on the ultrasound is like a ring light, if you want. So I just check if it was down. If it was not down, I would confirm by the detailed ultrasound, and then we would schedule because they can turn the baby by what they call external cephalic version, which is just they take the baby and turn it. It works half the time. Depends a lot on the experience of the person doing it. I had a fantastic gynecologist in my hospital, and she was so good. She had, I think, 90% success rate, and she would turn all those babies, but she was very patient. And often, surprisingly, she was telling me, like, if the baby was breached, you would think that it would turn like, a front flip, but most of the time she said the back flip were easier and the baby would turn more easily this way, which is a fun fact for me. At one point she told me, oh darn, I cut my fingernails for nothing, because you have to push on the pregnant woman's belly. And she goes, I cut my fingernails for nothing. The patient came, she did a quick ultrasound and the baby had turned its head, so it didn't need to be turned around again.